Radboud University welcomes international students from all over the world. As an international student, you come to Nijmegen to study. But what do you do if you become ill?
This is what you need to know about the Dutch healthcare system.
In the Netherlands, obtaining help with healthcare issues always starts with a visit to the general practitioner, the GP.
The GP in Dutch is called a huisarts.
The GP can help you with all kinds of medical problems. You must register with a practice in the city that you live in. To make an appointment, always call the GP's assistant. You cannot directly visit a specialist. If needed, your GP will provide a referral letter. For George, this came as a surprise.
In Lebanon, you can go straight to a specialist if something is bothering you. In the Netherlands, however, you first have to go through a GP who can then send you to a specialist.
Dutch GPs only prescribe medication if the body can't recover by itself.
If, for example, you get the flu, you need to call the doctor. You will talk with the assistants and the assistant will tell you, well, wait a week and see if it gets better, otherwise just take some paracetamol.
This might be different from what you're used to in your home country.
In the beginning, I was really disappointed, but then I got to understand that it's just a cultural difference.
If you have a problem that is urgent, but not an emergency, your GP has a phone number for urgent cases. When the GP's practice is closed, you can contact the GP Advice Centre, Huisartsenpost, through this number, 0900 8880. Always take your medical insurance card when visiting the GP. In the case of a medical emergency on campus, always first dial 024 365 5555. In all other cases, call the emergency number 112. You can also go directly to the accident and emergency department at the nearest hospital, but only if it really is an absolute emergency.
If it's not an emergency, you will risk a fine.
George's sister once had a bike accident. George dialed 112 and within minutes an ambulance was there.
The only downside with that was that my sister wasn't insured, and so we had to pay back a bill of 800 euros.
Please keep in mind that dental costs are not always automatically covered by your medical insurance. And bring your medical insurance card when you visit the dentist.
I once had to do research for my studies and I was really stressed about it. I had a lot of deadlines and a lot of work to do. I didn't know how to handle it anymore.
Studying in a foreign country is not always easy. Don't keep your problems to yourself. Radboud University has student psychologists and counsellors in-house. You can make an appointment at the Student Information Desk. As we all know, it's better to be safe than sorry. So when it comes to insurance, prepare yourself well. Please make sure that you have the medical insurance that you need. Want more information on all of these topics? Check out our website. Have a nice and healthy stay at Radboud University Nijmegen.